A blood pressure pill can help protect your heart, your brain, and your kidneys. But the strange part is that the very same pill that helps one person feel safer can make another person feel tired, swollen, foggy, dizzy, or just not quite like themselves. And that is where a lot of people get tripped up. They assume the symptom must be aging, or stress, or poor sleep, or maybe they think they're just having an off week, but sometimes the clue is sitting right there in the medicine cabinet. So in this video, I want to walk you through the 7 side effects I most want people to understand if they're taking Amlodipine, Losartan, or Lisinopril. And I'm not just going to list them. I want to help you understand why they happen, which medication is most likely to cause them, when they're usually harmless, when they're not harmless at all, and how to talk to your doctor without guessing or panicking. Because the goal here is not to make you afraid of treatment. The goal is to make you smarter about treatment. Before we dive in, please subscribe to the channel for practical health guidance that helps you live longer and better. And if this is our first time meeting, I'm Dr. Jessica Morgan. Every week on this channel, we break down common health questions in a way that is evidence-based, practical, and actually useful in real life. And one quick reminder before we get started, even though I'm a physician, I'm not your physician. So this video is for education, not personal medical advice, and any medication change really does need to go through your own clinician, especially when we're talking about blood pressure medicine. Now, one important clarification right up front, because these 3 medications are not interchangeable even though they all treat blood pressure. Amlodipine is a calcium channel blocker. Losartan is an ARB. Lisinopril is an ACE inhibitor. They lower blood pressure through different pathways, which means they also come with different patterns of side effects. That matters, because if you know the pattern, you can often figure out which medication is the likely culprit instead of blaming everything on your age, your diet, or some vague idea that your body is just slowing down. And there's one more thing here that is especially important. A lot of people are on one of these medications. Some people are on 2. But Lisinopril and Losartan together is not a routine combination for most people because that ACE inhibitor plus ARB pairing can raise the risk of problems like high potassium and kidney issues in the wrong situation. So if you happen to be taking both of those at the same time, that is not automatically wrong, but it is something you want to review carefully with your doctor and make sure there is a very clear reason. The bigger issue, though, is that side effects from blood pressure medication often hide in plain sight. They don't always announce themselves dramatically. They show up as ankle swelling at the end of the day, a little dizziness when you stand up, a cough that just will not leave, fatigue that makes you think you're getting older faster than you should be, a strange sense of weakness, or a blood test that suddenly comes back a little off. And the risk is not just discomfort. The real danger is missing the pattern early enough to fix it before it becomes a fall, a fainting spell, an emergency room visit, or a dangerous lab abnormality. So let's start with side effect number 1, and this is probably the most classic one with amlodipine: swelling in the ankles, feet, or lower legs. This is one of those side effects that sounds minor until you've actually had it. People will tell me their shoes feel tighter by evening, their socks leave deep marks, or one day they look down and think, why do my ankles look puffy all of a sudden? And because swelling can also happen with heart failure, kidney disease, vein problems, or being sedentary, it can be surprisingly confusing. What makes amlodipine tricky is that the swelling it causes is not always about your body holding on to extra fluid the same way a heart or kidney problem might. Amlodipine relaxes blood vessels, and that shift in pressure can allow fluid to leak into tissues, especially down in the lower legs where gravity already makes life harder. So some people get put on a water pill when the real issue is not total body fluid overload. It's the medication effect itself. And that's why the solution is not always just take a diuretic. Sometimes it's lowering the dose. Sometimes it's switching the drug. Sometimes it's pairing it differently. Now, when should you worry about swelling versus just noticing it? If it's mild, symmetrical, and clearly started after amlodipine, it may be more of a quality of life problem than a dangerous one. But if the swelling is rapidly worsening only on one side, or comes with shortness of breath, chest pressure, sudden weight gain, or severe fatigue, that is a different conversation. Because at that point, you are not just asking, is this amlodipine? You're asking, could this be my heart, my lungs, a clot, or something bigger? And that is where waiting too long becomes a mistake. Side effect number 2 is dizziness, lightheadedness, or feeling faint. And this one can happen with all 3 medications. It's also one of the most underestimated medication problems in older adults because people normalize it. They'll say, I'm just a little wobbly when I stand up, or I'm fine after a few seconds, or it only happens in the shower. But those few seconds are exactly where falls happen. Those are the seconds where somebody grabs the counter, misses the chair, blackens an eye, or breaks a wrist. And once that happens, the blood pressure number on the chart becomes much less important than the injury. This side effect usually comes from blood pressure dropping too much or dropping too quickly when you change positions. It's more likely when you first start a medication, when the dose gets increased, when you're dehydrated, when you've had diarrhea or vomiting, when you're drinking alcohol, when it's hot outside, or when several blood pressure medicines are layered together. And the frustrating thing is that your seated blood pressure in the clinic can look completely fine, while your standing blood pressure at home tells a very different story. That's why symptoms matter as much as the number. If you take one of these medications and you keep having that head rush when you stand up, do not brush it off. I would want to know, does it happen in the morning, after meals, after exercise, after a hot shower, or only when you get out of bed? Are you also taking a water pill? Did you recently cut salt dramatically? Did the dizziness start after a dose increase? Those details are not small. They're exactly how you figure out whether the problem is overtreatment, dehydration, timing, or a medication interaction. And once you know that, the fix becomes much more targeted. Side effect number 3 is the famous dry cough, and this one points most strongly toward lisinopril. If you have ever heard someone say, "I've had this weird tickle in my throat for months and nobody can explain it," lisinopril should absolutely be on the list. The cough is usually dry. It's often persistent. It can be worse at night. It can feel like there's something in your throat that you just cannot clear. And because it doesn't come with fever or the usual cold symptoms, people end up bouncing between cough drops, inhalers, allergy pills, and reflux treatments before somebody finally looks at the medication list. The reason lisinopril does this is biochemical, but the practical takeaway is simple. This is a known class effect with ACE inhibitors. Losartan, which is an ARB, is much less likely to do this. So when someone develops a dry cough on lisinopril, one of the most common solutions is not to tough it out. It's to talk to the prescriber about whether an ARB like Losartan would make more sense for that specific person. And sometimes the answer really is that straightforward. You don't need 10 more tests. You need to ask whether the medicine pattern matches the symptom pattern. Now, not every cough on lisinopril is from lisinopril. That part matters too. If the cough comes with fever, wheezing, chest pain, coughing up blood, weight loss, or true shortness of breath, you cannot assume it's just a medication side effect. And if someone has heart failure, asthma, COPD, or reflux, the story gets more complicated. But a dry, nagging, unexplained cough that starts after lisinopril and just hangs around, that is a classic clue. And a lot of people live with it far longer than they need to because nobody connected the timing. Side effect number 4 is high potassium, and this is where Losartan and Lisinopril really deserve respect. Because potassium problems can be dangerous while still being completely silent. That's the part a lot of people don't realize. You do not always feel high potassium building up. Sometimes the first clue is just the blood test. Other times you might notice weakness, heavy legs, tingling, palpitations, muscle cramps, or a sense that your body just feels electrically off. But you cannot rely on symptoms alone, because the heart rhythm issues that high potassium can cause are not something you want to discover late. This is also why I pay extra attention when someone is taking Losartan or Lisinopril and then adds other things on top. Potassium supplements, salt substitutes made with potassium, certain diuretics that spare potassium, NSAID pain relievers like ibuprofen, dehydration, kidney disease, diabetes, advanced age, and especially combining an ACE inhibitor with an ARB can all push risk higher. So if someone tells me they are eating healthy, using a salt substitute, taking lisinopril, and recently had a stomach bug, my ears go up immediately. Because what sounds like several separate little details can add up to one very real problem. And this is one of those situations where feeling mostly okay is not enough reassurance. If you're on lisinopril or Losartan, especially after a dose increase, or after an illness that dried you out, your lab monitoring matters. It is not busy work. Potassium is one of those numbers where the difference between mildly elevated and dangerously elevated is not something you want to guess at from your living room. So if your doctor orders repeat labs, please do them. That follow-up is part of the treatment, not an optional extra. Side effect number 5 is kidney function changes, and this one also shows up most with lisinopril and Losartan. Now here's where nuance matters because this topic gets oversimplified all the time. A small bump in creatinine after starting an ACE inhibitor or ARB is not always a sign that the medicine is hurting you. Sometimes it reflects the expected change in kidney blood flow that comes with the way these drugs work. And in many patients, that same mechanism is part of why these medications protect the kidneys long term. So not every number shift is an emergency. But there is a line between expected change and too much change. If kidney function worsens significantly, especially in the setting of dehydration, vomiting, diarrhea, an added NSAID, heart failure, severe infection, or a risky drug combination, then you are in different territory. This is where people can feel weak, dizzy, nauseated, or just off, and sometimes they don't feel much of anything at all. Again, the lab work is what reveals the story, and that's why these medicines are safest when symptoms and lab trends are interpreted together, not in isolation. One of the classic setups for kidney trouble is what clinicians sometimes think of as a medication pileup problem. Someone is on Lisinopril or Losartan, then they take ibuprofen for back pain, then they get dehydrated, and maybe they're also on a water pill. Individually, each piece might seem manageable. Together, they can be rough on the kidneys. So if you are on one of these medicines and you get a bad stomach illness, or you're not keeping fluids down, or you suddenly need frequent NSAIDs for pain, that is the kind of moment when I want people to pause and check in with their medical team instead of assuming it will all sort itself out. Side effect number 6 is fast heartbeat, pounding heartbeat, chest discomfort, or a general sense that your circulation suddenly feels different. Amlodipine can do this more than people expect, especially when the dose is changed or when someone is particularly sensitive to vessel relaxation. People may describe flushing, a warm face, headache, a racing pulse, or a thudding sensation in the chest. And most of the time, if this is from the medication, it is not a dramatic emergency, but it can be unsettling, and in some people, it's a reason the drug simply does not feel tolerable. The important thing is not to overreact and not to underreact. If you start amlodipine and notice some flushing, a bit of headache, or a more noticeable heartbeat, that can be part of the medication effect and may settle. But if you are getting new chest pain, worsening chest pressure, fainting, severe shortness of breath, or an irregular rhythm that feels significant, you do not sit there and debate it. You get evaluated. Because although rare, serious heart-related symptoms can overlap with what people might casually label as just a side effect, and that is not a gamble worth taking. There is also a subtle point here with all blood pressure medications. Sometimes the problem is not the medicine alone. Sometimes it's the interaction between the medicine and the person's baseline body. A patient with underlying coronary disease, dehydration, anemia, a fast heart rate, poor sleep, caffeine overload, or anxiety may feel those shifts in circulation much more intensely. So when you hear me say, this could be a side effect, I never mean that in a simplistic way. What I mean is that the medication may be the trigger that exposes a body system that was already a little vulnerable. Side effect number 7 is the one I never want anyone to ignore, even though it's rare: swelling of the lips, tongue, face, or throat, which can signal angioedema or a severe allergic type reaction. This is most classically associated with lisinopril, and it can be life-threatening because it can interfere with breathing. The tricky thing is that it does not always arrive with drama at first. Sometimes it starts as lip swelling, tongue fullness, hoarseness, or the sensation that your throat feels strange. If that happens, you do not wait to see if it passes. That is emergency territory. And yes, losartan can very rarely be associated with similar swelling to, though the risk is typically much more discussed with ACE inhibitors like lisinopril, there are also certain groups who may carry higher risk, and timing is not always predictable. Some people assume if they were fine during the first week, they're completely in the clear forever. But angioedema does not always read the rule book. So the safest rule is the simple one. Face, tongue, mouth, or throat swelling while on these medications needs urgent attention, especially if there is trouble breathing or swallowing. Now, those are the 7 side effects I most want you to know: swelling, dizziness, cough, high potassium, kidney issues, circulation symptoms like palpitations or chest discomfort, and angioedema. But there are also a few secondary effects that often ride along with these medicines and muddy the waters: fatigue, headache, nausea, diarrhea, weakness, flushing, and sometimes brain fog. None of those automatically means the medication is wrong for you, but if they show up after starting a drug or increasing a dose, they deserve a second look. The timing matters, the pattern matters, and your lived experience matters. So how do you actually sort this out without turning every symptom into a crisis? This is the framework I like. First, ask, when did the symptom begin relative to the medication? Did it start a few days after starting amlodipine? A few weeks after lisinopril? Right after a dose increase? After adding a second blood pressure medication? After a bout of dehydration? Medications leave footprints in time. And when you line the symptom up with the treatment timeline, you often get much closer to the answer than by focusing on the symptom alone. Second, ask, does the side effect pattern fit the drug pattern? Puffy ankles? I'm thinking amlodipine, dry cough. Lisinopril moves up the list. High potassium or kidney labs changing. Losartan and Lisinopril deserve attention, especially together or with kidney disease in the background. Dizziness? That one can be any of them, but the context matters. Palpitations and flushing? Amlodipine climbs higher. Throat or tongue swelling? Lisinopril becomes a major concern. This is not about self-diagnosing perfectly. It's about noticing that blood pressure drugs do not all misbehave in the same way. Third, ask, what objective information can I bring my doctor? Because I don't feel right is important, but I don't feel right and here's exactly what I've noticed is much more actionable. Bring your medication list, including supplements. Bring your home blood pressure log with the time of day. If dizziness is the issue, check your pressure sitting and then standing if your doctor has told you it's safe to do that. Note any swelling, cough timing, recent illnesses, salt substitute use, NSAID use, or whether symptoms cluster after your morning pill. This turns a vague complaint into a solvable puzzle. When I'm working through this with patients, I'm usually looking for tolerance, safety, and net benefit. Is the medicine doing what we want? Is the person able to live well on it? And are we protecting them without introducing a new problem? Sometimes the answer is to stay the course because the side effect is mild and temporary. Sometimes the answer is to change the dose. Sometimes the timing of the medication needs to shift. Sometimes one drug in the class gets swapped for a cousin that the body tolerates better. And sometimes the right move is to pull back because the side effect risk is no longer worth it. What I do not want people doing is making abrupt medication decisions on their own, especially with blood pressure drugs. Stopping them suddenly can backfire. The blood pressure can rebound. Chest symptoms can worsen. And if you stop one medication but keep the others, you may create a whole different imbalance without meaning to. On the other hand, I also do not want people minimizing dangerous symptoms because they're afraid of being dramatic. There is a middle ground here, and the middle ground is informed action. Not panic, not denial, just good clinical judgment supported by good communication. So let me give you a practical breakdown of when to call soon and when to call now. Call soon if you develop persistent ankle swelling, a dry cough that won't let up, frequent dizziness on standing, unusual fatigue, or home blood pressure readings that suddenly seem much lower than usual after a medication change. Also call soon if you've had vomiting, diarrhea, poor fluid intake, or you started using NSAIDs regularly while on lisinopril or losartan. Those are exactly the situations where side effects and lab problems can sneak up on people. Call now or seek urgent evaluation if you have swelling of the face, lips, tongue, or throat, trouble breathing, fainting, new severe chest pain, severe weakness with palpitations, or signs that suggest a major kidney problem or dangerous dehydration. If you stop making urine, if you're extremely lightheaded, if your heart feels erratic in a serious way, or if you simply feel acutely unwell after a medication change, those are not wait until Monday symptoms. Those are get help symptoms. And when in doubt, I would always rather you escalate sooner than explain later why you waited. Now I want to circle back and make this medication specific for a second because clarity helps. Amlodipine is the one I think of when I hear about ankle swelling, flushing, headaches, and sometimes a pounding heartbeat. It can be a very effective medicine and many people do beautifully on it. But when somebody says, my shoes suddenly don't fit by evening, or my legs feel heavy and puffy, or I feel warm and my heart feels noticeable, I want amlodipine on the table immediately as a possible explanation. Losartan, for me, raises the most concern around dizziness, potassium issues, kidney monitoring, and interactions with things like dehydration, salt substitutes, and NSAIDs. It is often very well tolerated overall, and many people prefer it precisely because it usually does not come with the classic ACE inhibitor cough. But it is not a set it and forget it drug. It still deserves follow-up. It still deserves labs. And it absolutely deserves more respect when someone is older, has chronic kidney disease, takes several blood pressure medications, or gets sick and depleted. Lisinopril is the one where the cough and the swelling emergency matter most in my mind. When someone has a dry cough that feels random and persistent, I think about lisinopril. When someone reports lip or tongue swelling, I think about lisinopril until proven otherwise. And like losartan, it also deserves real attention around potassium and kidney function, especially in the setting of dehydration, other interacting medicines, or pre-existing kidney disease. None of that means lisinopril is a bad drug. It means it's a powerful drug, and powerful drugs need thoughtful monitoring. If you are on more than one blood pressure medication, the conversation gets even more individualized. Because side effects are not always additive in a neat way. Sometimes one medication causes the symptom and the second medication makes it more noticeable. Sometimes the combination lowers blood pressure beautifully, but makes standing up miserable. Sometimes a person is technically at goal on paper, but functionally worse in real life because they feel weak, slow, foggy, or unstable. And that is why I always come back to the same principle. The right blood pressure plan is not just the one that normalizes the number. It is the one your body can safely live with. And that brings us to something people rarely hear often enough. Success with blood pressure treatment is not only about getting lower, it's about protecting the heart, protecting the brain, protecting the kidneys, and preserving the person. If the medication strategy gives you perfect numbers but leaves you swollen, dizzy, coughing all night, or skating toward a lab problem, then the work is not done. The plan needs refinement. Sometimes that refinement is small, sometimes it's major, but the point is that side effects are not an inconvenience outside the treatment story. They are part of the treatment story. There is also good news here, and I do want to emphasize that. Most side effects can be managed once they're recognized. A dose can be adjusted, a medication can be switched, labs can be monitored, dehydration risk can be addressed, a dangerous combination can be caught before it becomes a crisis, and sometimes people feel dramatically better after what seems like a very minor medication correction. That's why this topic matters so much, because the difference between something is wrong with me and this medication needs tweaking can completely change a person's quality of life. So if you're taking Amlodipine, Losartan, or Lisinopril, here's what I'd want you to remember most. Know the pattern. Watch the timing. Respect new symptoms. Don't ignore swelling, dizziness, cough, weakness, palpitations, or changes that started after a medication shift. Be especially careful with dehydration, NSAIDs, potassium products, and unreviewed supplement use. And if you happen to be taking both lisinopril and losartan, make sure that combination has been deliberately reviewed, because that is not something I'd want anybody assuming is automatically routine. And finally, please do not stop any of these medications on your own just because a side effect sounds familiar from this video. Recognition is the first step, not the last step. The right move is usually to take the pattern you noticed, pair it with your blood pressure readings and medication list, and bring that to your doctor or pharmacist so the plan can be adjusted safely. Blood pressure treatment is one of the most useful tools we have in medicine, but like any useful tool, it works best when it's fitted to the person holding it. I hope this helped you connect symptoms to the medications more clearly, and maybe gave you a better sense of which warning signs are routine, which ones deserve a phone call, and which ones are true emergencies. If this video made you think of someone in your family who keeps saying, "I'm just getting older," when they're really describing a medication side effect, send it to them. Sometimes that one conversation is what keeps a manageable problem from becoming a dangerous one. Stay well, take care of yourself, and I'll see you in the next one.